Hello, this is Dr. David Greene, CEO of the Texas Pain Network. Today's topic is what you need to know about occipital nerve blocks. An occipital block is an injection of numbing medicine next to the occipital nerves. They're located on either side of the scalp, originating at the neck. There is a greater and a lesser occipital nerve, either one of which can produce pain. They only have a sensory function. Neither one of them does anything with motor. Okay? The injection is designed to stop the pain traveling along these nerves, which can lead to occipital neuralgia, cervicogenic headaches, and or migraines. And the injections serve both a diagnostic and a therapeutic purpose. So the symptoms of occipital neuralgia can include pain in one or both sides of the head, a tender scalp, aching, burning, throbbing pain, and it may be described as a sharp or electrical shock in the back part of the neck and head. The ones who benefit from an occipital block include those who have occipital neuralgia. This can be one side or bilateral. Migraine sufferer, cervicogenic headache is by definition any headache caused by the neck. Okay, and this is typically one-sided. Cluster headaches are one of the most painful headache types. They actually do well with occipital blocks. The procedure is a quick procedure. It can be done in the office in just a few minutes. You don't need sedation. You don't need fluoroscopy, image guidance. Basically what the pain doctor will do is feel the point of maximal tenderness at the base of the skull on whichever side is the problem, or it could be both, or they'll just do it separately. The doctor will move the needle to inject both nerve areas with numbing medicine and possibly steroid. Okay? So you have the greater occipital nerve and the lesser. The doctor may move the needle around to get both areas for a block. How well does the procedure work? For such a quick, low-risk procedure, it works amazing. Usually it's pain relief within minutes. For cervicogenic headaches, studies show a 50 to 90% response rate, averaging 2 to 3 months. Okay? For cluster headaches, an 85% response rate, and it could be 4 weeks to 4 months, so it may need to be repeated. Occipital neuralgia has an 85% response rate for 1 to 2 months, and then for migraines it's a 60% response rate, averaging 4 to 5 weeks. So all of these do well, it just might be that they need to be repeated every month or so. When the pain relief wears off, what's next? Repeating the procedure can work very well, or a person can go on to have a pulsed or a regular radiofrequency ablation of the occipital nerve. This is meant to provide a much longer term pain relief. And basically what's happening is the catheter is being placed around the occipital nerve and thermal energy is being put through either in a straight fashion or a pulsed fashion, depending on what the pain doctor's experience is. There are no large studies available on this, but small ones show that it works exceptionally well. It's a very low-risk procedure. You're outside the spinal canal. You're not anywhere close to the spinal cord. This is not a motor nerve. It's only a sensory nerve, so it's very low risk. The risks are minimal with this procedure. You might have some slight bleeding, an infection, or allergic reaction. There's no risk of a CSF leak or a spinal cord injury. The top non-operative pain management in Texas is through the Texas Pain Network. There are several affiliated clinics throughout the state accepting over 50 insurances and providing over 25 treatment options. The average success rates exceed 90% with the board-certified award-winning doctors. Visit us online at texaspainnetwork.net and then call us at 877-877-8556. I'm Dr. David Greene with the Texas Pain Network. Your pain stops here.